you.
Thanks for having me again.
What are the signs of colon cancer?
Yeah, so just like most cancers, most people with early cancers don't really show any signs and they're asymptomatic. As things progress along, and it doesn't necessarily mean you're a later stage, but people may see some bleeding from below. They may have some abdominal pain, or they may have signs of obstruction, whether it's narrower stools or constipation or things like that.
Why are screenings so important, and what age should you start colon cancer screenings?
So the numbers on colon cancer have gone down a lot because we're catching things a lot earlier. The deaths from colon cancer have gone down a lot because of the earlier screenings. The reasons being, we try to catch these things at earlier stages, and that's why we recommend screening at age 45. Technically, you're supposed to be getting your colonoscopies from the ages of 45 to 75, with potential for need for further beyond that if you're having any other symptoms that may indicate it. But age 45 is technically, if you're an average risk patient, when you're going to start going them. If you have family histories or signs of irritable bowel disease or other types of colonic abnormalities, you may have recommendations for earlier screening.
When is Cologuard acceptable to use instead of a colonoscopy?
Yeah, so Cologuard is the big new thing, and I think nobody looks forward to their colonoscopy. So when Cologuard came out, I think a lot of people asked a lot of questions about it to try to avoid it. No matter what, the colonoscopy is the standard for screening for colon cancer. That being said, for an average risk patient, Cologuard is an option for 45-year-old and above if they do a couple of other things along with it. This Cologuard is a stool test. It actually tests for the DNA within the stool to see if there's any genetic abnormalities within the stool that might make you higher risk for cancer. It is not, a negative test will not rule out a cancer, but it will also not give you the answer that you have a cancer because you have it. If there's signs of any concern, colonoscopy is still recommended. But if you're going to go the Cologuard route, they still recommend what we call a flexible sigmoidoscopy every 5 to 10 years, where they look at the lower part of your colon and rectum, as well as a CT scan to look every 5 years to make sure there's no obvious signs of anything else that might be going on inside your belly.
Can Cologuard detect polyps?
It will not detect polyps. It really just looks at the DNA abnormalities. A couple other things they may use are blood tests in the stool to make sure that there's no hidden blood within your stool, because that can also be a sign of cancer. So it's similar in that concept. It's just detecting the DNA within the stool.
Probably the safest route would be a colonoscopy, even though it's something you dread.
I think most doctors would recommend a colonoscopy if you're able to tolerate it. I think it's definitely the safest tool and the best chance of catching anything early.
Dr. McCure, thank you so much. Always great to have you.
I appreciate you having me again. Thank you so much.
Thank you. Up next, Joanne Dill with the Better Business Bureau is here. Stay with us.